Well, welcome to another one of our Mayor's Emergency Roundtable discussions. Today we have with us Dr. Jared Cotton, Superintendent of Public Schools, and Dr. LaToya Harrison, Chief Academic Officer. So we're here today to talk about the opening of schools. I know there was an article in the paper yesterday. Dr. Cotton, I think, did a fairly good job of explaining, but this is a moving target for all of us and for you, and I know that you've had to go from one direction to another, and so when you have to make changes, it does create a sense of confusion and a lot of questions, and so you are here today, both of you are here today to help explain exactly what Chesapeake is doing and perhaps why we're doing it, which I think is very, very important and very valuable. I was talking to Dr. Cotton a little before we came on the air, and I noticed that the state has come out with guidelines as to how to reopen schools, how they're giving advice to school systems throughout our Commonwealth. And as it turns out, it looks like they came to Chesapeake and asked, what did Chesapeake do? Because that's what they're recommending to all of the school systems throughout the state. So I think, once again, speaks for the decisions that you're making. I know they're tough. I know that there are people who do not agree with whichever way you go. But at least let's get them to understand. So let's get going. Seeing a lot of school buses today, and that's pretty interesting. How are things going?
Well, thank you again for having us here today. Things are going great. We're very excited to see our students back in school. You know, just to remind everyone, our goal is to bring all of our students back to school, especially all the students and families who asked to be back in school for option one, the on-campus continuum. We want them back as much as possible, but we want them back we want them to be safe, of course, and that's a big challenge that we continue to face as we move forward. But I'm excited to tell you that things are going very well. I visited several schools. Members of my superintendent staff visited several schools. We had school board members who went out, and it really did our heart good to see our young learners coming into school. I'm so excited that our on-campus continuum students, now keep in mind we still have our option 2 online students who are working from home, and of course they made that commitment for the first semester. But the option 1 on-campus students, the pre-K through 3rd grade, are now attending 5 days a week. As of this week, our grades 1 through 3 joined pre-K and kindergarten for 5 days a week of instruction. And as I've gone around, I see them wearing the masks. I see them practicing hand washing, social distancing. They're doing an outstanding job with that. I even commented that to the public that their masks are much better than mine. You know, of course, they're really embracing these protocols. We also have our special ed self-contained students who receive 90% of their services. They're attending 5 days a week. And I want to just point out that we really drawn a line in the sand. We feel strongly that our youngest learners, our most vulnerable populations, need to be in school 5 days a week. And I know some of our surrounding school divisions have not been able to do that for various reasons, but we've worked hard to make it happen because we know how important that is. And so far, things are going great, but it's not by accident. It's because of our staff. A big thank you to our teachers, our students and families for their ongoing support. I want to thank our bus drivers, our custodians, our support staff in all of our buildings, all of our staff. It takes all of us together to work together to keep our students and staff safe. And there are lots of things that they're having to do that they've never had to do before. And they're doing it because they care about students and they understand our mission and our purpose and why we're here.
So you mentioned the survey, the options. I did have a conversation with one person who was not pleased with the fact that some kids were going to school. And my question to them was, don't you have the option? And so, I mean, it's hard to complain, although you hear complaints. It's hard to legitimately complain when you as a parent have alternatives. And I just think that's a great thing and hopefully something that we may be able to do in the future. So let's talk about the timetable, who's coming back when, because I think that's one of the things every school division, even particularly right here in Southampton Roads, each city seems to be doing different things. So when you read in the paper what Chesapeake is doing, people may get confused because Virginia Beach is doing something else. But let's try to make it clear to everyone exactly what the plan is for now.
Certainly. We just presented at a recent school board meeting our plan. We wanted to go ahead and map out grades 4 through 12 because those are the grades who have not yet returned to school. And I know that we'll talk about the reasons why the blended, because that's probably the most frequent question I get is why are we looking at the blended versus 5 days a week? And really it comes down to numbers. And I know we'll talk about that as we move forward. But we did present that on October 12th, grades 4, 5, and 6, as well as our Career Center students will come back on the hybrid plan, or the blended plan, we call it, which is 2 days of in-school instruction and 3 days of at-home instruction, which I know Dr. Harrison will talk about in more detail here shortly. On October 26th, we'll bring back our 7th grade students on the blended model. November 9th, our grade 9 students will come back because we feel like our 9th graders need to come back ahead of the other high school students. Because as you know, Dr. West, when you are coming back as a high school student, you need to first figure out how to navigate through the school and find your class and those large buildings. So we felt like orientation was going to be so important. And then, of course, November 12th, we have grade 8 coming back, which really aligns to the start of the second 9 weeks for them. And 11, 16, or November 16th, we have grades 10, 11, and 12 coming back on the blended model. And then, of course, using this blended model, we'll talk about in more detail. But our real purpose is we want to engage students and we want them on campus as much as possible. We do know that our goal should be 5 days a week for our students to be on campus learning. But whether they're on campus or working at home, we want all of our students engaged in learning 5 days a week, essentially. So we'll talk more about that blended model here in just a minute.
Okay, before we go to the next question, let me just ask a follow-up on this. I know you gave the rationale as to why certain grades are coming back at certain times, but as I look at, say, the first step is 4, 5, and 6, are all 6th graders in middle schools?
All 6th graders whose families chose the option 1 on-campus continuum. And I also want to point out that I mentioned this at the board meeting, grades 4 and 5, we hope that's going to be temporary on blended model because we want them 5 days a week. That's our goal. So we have said that by second 9 weeks at the latest, we want to find a path forward to have our 4th and 5th graders come to school 5 days a week. And of course, our hope ultimately is that all of our students come to school 5 days a week, as we've said. But I want people to understand that as we move toward the blended model and then prepare for the 5 days a week model, it's a continuum. And as we can move safely, we will, because our goal is to get to those 5 days.
So the 4th and 5th grade, are they all in separate buildings with K-3, or do you still have some K-5 schools?
We have some K-5 schools. We have some 3 through 5 schools, intermediate schools. We still have some primary schools. Okay. As you know, we have a couple schools that have K through 3. So obviously, that creates a new challenge for some of our intermediate schools. They're just receiving 3rd grade students as of today, but we have other schools, K-5, as you know, they're going to receive all of those students K through 5. So when you're looking across the school division, we have to go to every school and look at all of their different challenges, and we have to help them work through those. So it's been a very intensive, comprehensive process that we've been involved in.
It may or may not have been your intention, but I'm looking at this from a principal standpoint. If I were principal of a building and looking at this plan, I would be excited because it seems, whether it was intentional or not, that a third of the kids, a third of those who choose to go to school will be arriving at the building at one time. And so would give principals and teachers an opportunity to make it a little easier for them to keep the social distancing. So I don't know if that was part of the plan, but it looks like that's how it's working out.
Well, certainly, and I'm glad you said that because our principals are very much involved in our planning. And of course, they receive input from their teachers and their staff. And we also have put out that we have a teacher think tank group that provides us with feedback and information. We've also had several forums where we've received feedback. We also have an online tool that we use to get feedback from our staff members and our community. And we're receiving feedback on a continuous basis. But the only way that we make this happen is if the people who are actually doing the work are involved in helping us create a path forward. And our principals have been very much involved, and their input is considered strongly as we make plans.
Yeah, we talked last time when you were together about that whole concept of keeping people involved, part of the process of making this, coming to the solutions. And I want to commend you for continuing to do that. I did read all the different groups that are involved in this decision making, so people shouldn't think they're in a box in an ivory tower at the top making these decisions. People on the ground involved are part of this solution, and that's probably why it's such a great plan. I guess next is some students are learning on campus, and you talked about this a little bit, and others are learning from home. What will that look like in the future?
Thank you. Thank you, Mayor. That's an excellent question, and certainly it's important to point out that one of the things that has been a top priority for us is ensuring that any family who wants the virtual option has that, and there's been that flexibility to switch to that option. And so our efforts have really been around trying to accommodate students who are learning in both models. So with our elementary students, our 4th and 5th graders, as Dr. Cotton shared, will be returning to school in a blended format where they will be attending school. Those who chose option 1 to be on campus, they will be attending school 2 days a week in person, and then on the 2 alternating days that they're learning from home, those students will participate in a live synchronous morning meeting session just like they normally would when they're attending school in person, and that gives the teacher an opportunity to set the tone for the day for all students. And then while they're at home, they'll be working through some asynchronous independent learning activities. We've purchased additional software where students can have more personalized experiences with a reading software program that allows them to access leveled readers and support at their reading level while they're learning from home. And then 1 day a week is designated a student support day, and on the student support day, that's where teachers can provide more personalized small group instruction to all students who may be learning from home and pulling students in small groups who may need some additional support mastering skills that were taught in that week. At the secondary level, and again, as I've mentioned, trying to accommodate both families who've chosen to remain at home with virtual learning and those who want to return to campus, one of the things that we noticed was that the scheduling at the secondary level is incredibly complex. And so to accommodate students in both models, we have what's called concurrently enrolled or dual rostered courses, where we have option 2 virtual students who are enrolled in the same courses as students who are learning in person. So in those cases, again, very similar in that those who are in option 1 who have chosen to attend school in person will return blended, where they are attending school on an alternating day schedule, 2 days in person, 2 days at home, and then 1 day as a student support day. But we get the question a lot, what will that look like with students learning virtually and students in person at the same time? And so what I like to tell everyone is that our students are learning virtually right now. The difference that they're going to experience when some students return to campus is that instead of seeing all of their classmates on one Zoom virtual screen, some of those students will be learning in that same class session in person. And so a teacher will have students on the screen who are participating in the class virtually and students in person participating in that same synchronous lesson. Of course, we're supporting our teachers and sharing lots of tools and resources with them so that they can accommodate learners in both models. And it's also important to point out that blended learning is something that is a newer concept, but it's also not something that's just here with us for COVID. We plan to take some of these same strategies and incorporate them moving forward as students return, hopefully in the near future, to more of a traditional format. It allows us to personalize the learning experience for students, leveraging the power of technology to make sure that we are meeting students where they are. And so a lot of the strategies and tools that we're sharing with teachers right now are just really good teaching practices that we hope to see continued in our classroom when we return return to normal.
That is honestly so exciting to hear you say that, because to me, as I think about education in general, public education in general, if there were an area that it needs improvement is flexibility to diversify for kids who have different learning needs. And so this seems to me like an ideal way to go in that direction. So, I guess kids, especially middle school and high school, children they go to school for a lot of different reasons. Academics, social,
Yes.
academic. People who have chosen the option to not be there, they're going to see their friends come into school, and maybe there's going to be a stronger need for them to make a change. Is it too early to say if that's possible?
No, our parents they were told from the very beginning that the choice for option 2, our online option, is for a semester. It's a semester-long commitment. And so if parents want to make a change, they will have that opportunity to do so. By December, they'll have to make that choice. And so we've been sharing that information all along with our families, so they know that they can make that change at that point if they wish to do so.
Right. So my next question is, how are we preparing and supporting teachers to make this transition to that? I don't know, Dr. Cotton or Dr. Harrison, who wants to answer that?
I'm excited to share about that, actually.
Okay.
So first of all, I have to say kudos to our teachers. If you walk into any of our classrooms right now, I think you would be just utterly amazed to see how our teachers have adapted to this whole new way of learning. As you recall, when during the immediate school closure in March, everyone had to pivot on a dime, and without much opportunity to prepare for virtual learning. Since that time, our school division has been working hard to provide additional support and professional development to teachers in our new learning management system, Schoology, which I know we'll talk a little bit more about that in just a moment. But and throughout the summer, our teachers have participated voluntarily, have participated in a lot of the professional development that's been offered throughout the summer, and many of them have even on their own have collaborated with their colleagues and just came back eager and with a lot of tools in their toolkit. Now we are shifting as we're preparing for blended learning and providing robust professional development opportunities in blended learning. First, to provide a foundation for our teachers where they'll kind of all get the same basic overview and session so that we're all speaking the same language and have the same tools in our toolkit. And then from there, personalizing options for teachers who may be interested in different models that they can incorporate in their classroom. We realize not every teacher needs the exact same thing. So just like we talk about personalizing for our students and differentiating, we will have a lot of differentiated personalized options for our teachers as well as they're shifting now to blended learning.
I was just thinking that same thing. For change is difficult for all of us, but it seems like the longer you're in a profession, the change would be more difficult. So you may have some teachers who are a little more resistant and some that are very eager. I know my daughter, for example, is a young teacher, and unfortunately she's not in Chesapeake, but she would love to have an opportunity to have this type of training to meet kids' needs. So I think it's very, very exciting.
And if I may, just one last thing to add to that, if I may.
Sure.
So I also want to point out that our curriculum team has worked tremendously hard throughout the summer, providing a wealth of resources and updating the curriculum. We've also embedded courseware through Virtual Virginia, which is the state's online course program, and so we have all of that content that we've been able to download into our learning management system that our teachers can access for virtually, almost every one of our courses, as well as content from WHRO. So they've got a lot of resources as well at their disposal that they didn't have access to before.
Wow. So it seems like, Dr. Cotton, we're starting to see things that we read about 15, 20 years ago about how public education improved. We're starting to see a lot of this right now. What is this term, Schoology? Who wants to talk about that?
Sure. So Schoology is...
Schoology, thank you.
No worries. I think that was an ongoing debate in the beginning. Is it Schoology or Schoology? But it's Schoology.
As I look at it, it does look more like Schoology, yeah.
Sure. No worries. So Schoology is a learning management system, and if you think about it this way, it's sort of a one-stop shop where we can, like a repository for all of our curricular resources, any activity, assignment, or resource that is related to a course is housed in this system. And it also provides an opportunity for teachers to communicate with students and to communicate with parents. It also offers opportunities for students to collaborate with one another through discussion boards. And so this is sort of the foundational organizational system that we use for all of our courses now. And our parents we've gotten a lot of positive feedback. Certainly it was a transition as everyone's is ramping up and learning how to utilize new tools and resources. But the benefit of it is that it really allows our parents to also stay really connected to what's happening in the classroom. They can monitor their students' progress through the learning platform. They can see exactly what their students are working on at any given time. And again, for our students, particularly in this season that we're in where we anticipate higher than usual absences due to, students maybe having to be out with, if they're symptomatic and things of that nature. And they can still continue their learning from wherever they are, utilizing the resources that are available to them through our learning management system, and so that they can keep on pace with their courses.
Wow. That's really awesome, especially the fact that parents, I think one of the things that has always been true about public education is the more parents can be involved in a child's education, the more likely they are to be successful in not only school and life. And you've included that as part of the plan, which I think is awesome. So schools certainly do look different today from what I remember. There's no doubt about that. So if families have any questions about blended learning or Schoology, let's say it again, Schoology.
Schoology.
Is there someone that they can contact for help?
Yeah, absolutely. Our schools are communicating details with our families in the coming days, and of course, they're on hand to provide support to our families. We do know that it's different, and I also want to emphasize that we're asking our teachers to do things they've never done before. So we're still learning as we're going along, and of course, we're committed to getting this right. But even though this is a very challenging time for all of us in education, it's going to benefit us in the long run. We keep telling ourselves that because these are some of the things that we're doing now were things that we're planning to do at some point in the future, have more personalized instruction, providing more online options for students, providing more flexibility in student scheduling, and meeting our students where they are has always been a focus for us because all students are at different places at different times. So we need to really make sure that we provide the instruction that individual students need, and that's been a focus of ours. So we're working through this. Of course, we appreciate the patience of our parents and community as we work through this. I have received some positive feedback from parents about online being much better than it was last spring, of course, because we had more time to prepare. But I've also heard feedback from parents in some cases where the workload might be higher than they were anticipating, but all of that feedback we appreciate because we're trying to work through that as we learn to operate in the new current normal that we're faced with. But any questions that our families have, reach out to the schools. That would be the first place, the principals and the administrative staff, the teacher really first. The teachers should be the first one they reach out to, but of course principals and administrators are here to help. And of course we have a link on our website under the Contact Us tab that's posted on our website where we're happy to respond to questions and provide information, and folks can do that anonymously as well. So that's on our website. It's our Let's Talk contact form that's available on our website, so we're here to help.
It sounds like a great plan, very exciting time to take advantage of unfortunate times. And as I think you said earlier, all of this is the plan that you all have devised with everybody's input. But all that could change very quickly should the numbers of infections increase suddenly. You may have to scrap and go take back. And I think we've been saying that all along, which again creates some anxiety and some uncertainty, which always creates fear. And that's so I'm assuming that's still correct.
Yes, thank you, Mr. Mayor, for bringing that up. We have said that several times, that our plan is tentative and that it could change. If you don't mind, I'd like to go back and just address something that we touched on earlier, and that's probably the biggest question I'm receiving is why are we doing blended for these grades 4 through 12, at least initially, rather than 5 days a week? And it really comes down to numbers. And that's so important that we continue to emphasize. I know that I said that at the board meeting, and I know that that was mentioned in a recent article, but we do need to provide at least 3 feet of physical distancing in our classrooms. So we have committed to 3 to 6 feet of physical distancing in all of our classrooms. And in some cases, and actually in many cases, our classrooms are only able to provide 3 feet of physical distancing, which is why our students have to wear a mask in the classroom. Matter of fact, all of our students and staff are wearing masks in the building across the board, just to keep our students and staff safe. Where that challenge comes in is you can't eat lunch, for example, at 3 feet of distancing. You have to be at minimum of 6 feet of distancing. So logistically, we have to move our students to other locations to provide that 6 feet of physical distancing to make sure that they can, because you can't eat lunch with a mask on, right? So we have to make sure that we provide a minimum of 6 feet of physical distancing in those situations. Our principals and staff are committed to finding a path forward to bringing our students back 5 days a week, but the blended model lets us bring in half of the on-campus students at a given time, so they're not all coming in at the same time, so that we can provide that required physical distancing. And by the way, this requirement does not come from our local health department. This comes from, CDC recommends 6 feet where feasible. The WHO, the American Academy of Pediatrics, the Virginia Department of Education says 3 feet is acceptable with a mask. So we have all of these health organizations providing us with this guidance that we need to follow. And until we are told we don't have to worry about the 3 feet, we're going to continue to have the challenge of the numbers, not to mention the transition when our students are moving through the hallways and moving through the building when we have to provide that physical distancing. So these are all things that we're committed to working through. It just means that it's an additional challenge that we're facing.
Well, this just sounds, to me, I would rather have a blended, even if I wanted full, I'd rather have a blended that lasts and keeps kids safe that you can continue to do, rather than bringing everybody together and then in 2 weeks the infection rate goes up and you have to close school for everybody. So it seems to me like a very rational, very thoughtful solution. Are there any issues that I have not asked that you'd like to bring up before we close?
No, sir. We appreciate the opportunity. We are going to continue to provide information to our community, and we're going to continue to answer questions. I know that Dr. Harrison has been working on something that we hope to get out to our families soon that really describes the blended model and how that's going to look, because that's probably the number one question we've received from parents is, what is this blended model and what's this going to look like for our families? And we have been working on something that will help clear that up, and Dr. Harrison went through some details on that today, but we're going to provide something for our families, and then of course, because they've never experienced it. So obviously we have questions. We have teachers who have questions because they need to deliver this model, and we're providing professional development for them before this model starts, and we shared those dates at our last school board meeting. So I will tell you that our students are going to continue to learn and thrive, and we're going to continue to do everything in our power to make sure our students are successful.
We do face challenging times, there's no doubt about it, but what is most special about Chesapeake, whether it's our school system, our emergency management team, our public safety departments, they all do one thing that I think is that makes us special, and that is to take time to plan. And I think you've heard today that our school system is under the leadership of Dr. Cotton is doing exactly that. They're taking the time to plan for things that could be, that things that are, and things that are not. So I want to thank you, Dr. Cotton, Dr. Harrison, for your role in this. It seems like you're fitting right into the Chesapeake model, and we appreciate what you're doing. So
Thank you.
that concludes our program.
Thank you.